That's a very important point that you're raising. We also have Dr. Ravi Kiran, Senior Consultant, joining us in the broadcast, Pediatrics and Neonatology at Sakra World Hospital, Bengaluru. Thank you very much for joining us, Dr. Ravi Kiran, and good afternoon to you. I would like you to comment on the point that just was made by Dr. Dalwai.
Yes, as Dr. Dalwai was pointing out, we are seeing the psychological impact also in phases or in waves. Initially, yes, we were worried about how to engage the kids and how to keep their physical as well as psychosocial development intact while they are protected in their families. So we went through phases of accepting the screen time and then allocating the screen time and then filtering the screen time. And now, as we can see, initially the screen time also is not, like say, not all the kids in the rural areas are having access to educational gadgets. So the gamut of this psychosocial and educational very huge, is very huge. So the present impact again is many questions arise from parents as to how to break the news of the of parental deaths on the kids to the kids, and the single parentage families are more because of young population dying. So definitely this needs a separate outlook and a separate planned out chartered study or strategy to address these issues over a range of time.
Absolutely. Dr. Kiran, I'd also like you to comment on the age theory, because the center has dismissed the age theory. Dr. Samir Dalwai also helped us understand the fact that during the lockdown, we were all indoors. After everything eased out and we saw an unlock period, youngsters started going out, they started stepping out, they were exposed more to the threat, and then you had the mutant strains. That is the reason why we see this infection or the higher rate of infection among youngsters. Does it exist, the age theory that is being discussed?
Age theory, in other words, how the virus impacts on people. It impacts differently on an elderly population than on younger population. Younger population were quite robust. But one thing about this coronavirus is that it hits through the body's own immune system. So we have to say that if somebody is very good in the immune system, in his immunity, it helps in the initial prevention of the virus from logging into him. But once the virus creates havoc, because of the host immunity. Now, in kids, the theory of why COVID is less affecting the kids till now has been a few theories of. One is the receptor for the virus itself is lesser in kids, was one proposition. But then that seems to be less of a truth, because this episode is seeing a lot of infection in the kids, but not a lot of disease. They are getting infected, but they are not turning into disease. The second theory is that if immune system is not mounting too much of IL-6, which is supposed to be one of the important immune mediators for severe infection, which is causing deaths in the adult population or elderly population. This IL-6
So there seems to be a bit of a network issue. I'm not able to hear you clearly, but stay on with us. I will take up another question with Dr. Dalwai. Meanwhile, we fix that line with you. Dr. Dalwai, you did highlight the psychological impact of all of this on children. Please also, help our viewers with your advice and your suggestions on how to deal with it.
My first advice is do not leave parents only to be handled by their children. Children are a national asset, or whatever you want to say. It's our responsibility as society, because like Dr. Ravi Kiran very correctly said, both the parents might be infected or maybe in the hospital, or God forbid one of the parents may have